Hi all, today I am here to discuss about the peptic ulcer. As you know, the peptic ulcer, it is a very important disease condition. So let's see what is peptic ulcer. The peptic ulcer, the word derived from the Greek, that is peptikos. Peptikos means able to digest. So let's see what is the definition of peptic ulcer. Peptic ulcer, it is the painful sore or ulceration in the lining of mucosa of digestive tract that is typically occurring stomach and duodenum. It is caused by the secretion of pepsin and gastric acid. So let's see what are the main etiology and risk factors of peptic ulcer. The first one is the Helicobacter pylori infection. Second is the smoking. And third is more intake of acidic drinks. And fourth one is the stress. And fifth one is any radiation therapies. And last we can see the stomach cancer. These are the main etiology and risk factors of the peptic ulcer. So let's see what are the types of peptic ulcer. Mainly there are two types. First one is the duodenal peptic ulcer and second is the gastric peptic ulcer. The duodenal peptic ulcer, the ulcer occurring in the small intestine, that is duodenal peptic ulcer. Second is the gastric peptic ulcer, the ulcer occurring in the stomach, that is called gastric peptic ulcer. So let's see what are the pathophysiology of peptic ulcer. Due to the etiological factors, as we had discussed, that is infections or other stress or radiation, stomach cancers and smoking, these are all the etiology. Due to these etiological factors, there is chances to damage the defense mechanism of digestive tract. That will leads to damage the lining of mucosa in the digestive tract. So it will leads to decrease the otherwise impair the somatic statin and also increase the acid secretions. This increased acid secretion will leads to ulceration or soreness of the gastric tract. Finally we can see the soreness and all ulceration in the parts of stomach and small intestines. That is called peptic ulcer. So let's see what are the signs and symptoms are there. The person have the peptic ulcer, the body will show some symptoms. So let's see what are the symptoms. First of all, there is a burning pain in stomach. And second is the bloating or fullness of the stomach. And next, sometimes the patient feel nausea and vomiting. And also changes in the appetite. Maybe they don't have any hunger or anorexia. Or sometimes they need to more intake. That is the changes of the in the eating habits. And also we can see the person have the chest pain and sometimes the blood in stool. So these are the main signs and symptoms or clinical manifestation of the peptic ulcer. So let's see what are the diagnostic evaluation we can do in the peptic ulcer. First one is the history collection. So we have to collect the patient history about their daily activities and previous history of the medical or surgical and what are the eating habits and all we should collect. We will get the idea about and we can easy to treatment also. Then next is the physical examination. That is every disease condition, it is a very important part, that is the physical examination, head to foot examination we have to do. The next one is the CBC. CBC is the complete blood count. The next test is the stool examination. and also we can do endoscopy. So these are the main diagnostic evaluation or investigation we can do the patient who have the peptic ulcer. So next we can discuss about the management. So after confirmation of the disease, we'll start the treatment. So here the management we can see first one is the lifestyle modification. So lifestyle modification we can do the smoking and alcohol cessation and also stress relief. And second is the pharmacological management. Here we have started to the treatment. The pharmacological management we can provide the medicines. So firstly we can give the prothrombin intuition or prothrombin. Second one is the antacid and third one is the prostaglandin analogues. So this all the medication will help to reduce the or suppress the acid secretions. Proton, antacid and prostaglandin analogues. The next we can see the already etiology we discussed about the Helicobacter pylori infections. So we have to eradication therapy of this infection. So mostly we can use for the antibiotics. Mainly we can use the antibiotics are amoxicillin and clarithromycin. The combination of amoxicillin and clarithromycin. And second also the same one of another combination we can do metronidazole plus clarithromycin. So these antibiotics will help to eradicate the infections. The infection is the Helicobacter pylori. So after the pharmacological management, let's see if the patient is not recover or otherwise they are developing the further complications, we can go for the surgery. So here we can see what are the surgical management. The surgery will help to decrease the acid secretion as well as it is improves the patient health. So let's see what are the surgeries. The surgeries are gastroenterostomy. The gastroenterostomy, it is the opening between the stomach and small intestine. Second one is the vagotomy. Vagotomy, you know the vagus nerve. So they will cut the vagus nerve. So that will be help to sustain or decrease the stimulation of secretions. So and also next we can see the pyloroplasty. The pyloroplasty, it is the width of pylorus to help to emptying the stomach. So next surgery is the Billroth first and last is the Billroth second. The Billroth first is a surgical procedure. It is the removal of the distant part of the stomach. And after it will be linked with the duodenum. And Billroth 2, it is the removal of the lower portion of the stomach. The remaining it will be linked with the duodenum. So this all the surgery will help to decrease the secretion of acid and it help to improve the patient health. So these are the surgical management. So let's see what are the nursing management. So here we discuss about the pharmacological, lifestyle management and as well as surgical management. So the nursing management is very important. Suppose in the medical we are given to the medication to the patient is recovered. So that also if the patient needs the surgery, so we provide the surgical or surgery management also. So as a nurse, we have to assess the patient condition and provide the comfortable position. And we have to monitor the vital signs and administer the medication as per the physician order and provide psychological support to the patient. If the patient having the surgical or surgical management, so here we have to provide the pre and post-operative management. In the pre and post-operative management, So we have to encourage the patient to do their daily activities as well as before the surgeries, and after surgery we should monitor any kind of the complications such as any bleeding or hemorrhage are occur or not. So next is the most important thing, we should care or management of the NG tube, nasogastric tube management and care. So these are the important nursing management we can provide the patient who have the peptic ulcer. So today we are discuss about the peptic ulcer. Peptic ulcer, it is the ulceration or painful sore in the lining of mucus of the gastrointestinal tract. So hope you all understand the peptic ulcer and its management. Thank you for watching this video. See you in next video. Bye-bye.